Hello, welcome to our page. Today I want to talk about acne and how to treat it. First of all, you're totally normal if you have acne, no matter how old you are, no matter your gender, no matter where on your body it shows up. If it's whiteheads, blackheads, cysts, papules, pustules, I've seen it all and I'm going to help you get through it. First, I'll say nothing beats a one-on-one appointment with a board-certified dermatologist to figure out the best treatment for your individual skincare needs. However, there are plenty of over-the-counter options while you're waiting to try on your own. I always like to tell my patients you didn't get the acne overnight. It's not going to go away overnight. You have to be patient. Now, if you overstrip your skin with witch hazel, if you smoke vape or smoke weed, if you're constantly picking, or if you just love to ask the dermatologist questions but not listen to our answers, the issue will be that your skin will not heal as readily as my patients. That I like to call the Johnny-on-the-spot patients that are texting stuff into their phones while they're talking to me, that want to know about chemical peels, that will stop picking the minute I tell them the first time. Those are the patients that do the best. So be a Johnny-on-the-spot patient. Sit at the front of your chair, listen to what I'm saying, focus on it, so that you can have clearer skin. The most important advice I need you to take away from this video is do not poke, pop, scrape, pick, or otherwise manipulate your acne. Touching it will only make it worse, and you can leave permanent scars or start an infection, none of which you want. So acne itself is a clogged hair follicle. There are various types of acne depending on how deep and how inflamed your acne is. In order to properly treat it, we first need to figure out what it is. Is it inflammatory acne or is it non-inflammatory? Non-inflammatory acne is also known as comedonal acne, meaning it shows up as comedones, those little bumps top with a white head or a black head. Comedones are usually pores that have gotten blocked with bacteria, oil, and dead skin cells. So white heads are closed comedones. They have a white or a light tip, while blackheads are open comedones. They appear dark because the melanin pigment in our natural oil oxidizes when it makes contact with the air. Whiteheads and blackheads are more common in people that smoke and those with more oily skin, but you can see them in anybody. Luckily, it's the most mild form of acne and it usually isn't painful, but it still can scar. You want to unplug the comedones with an effective topical treatment, not by poking and prodding at your face. So in terms of non-inflammatory acne treatments, now people love those super satisfying pore strips that show you all the gunk you've pulled out your pores, and these work by temporarily removing maybe some of the debris on the top layer of your skin and that oxidized oil and dirt that sometimes comes with it. During a breakout, this could be a good way to remove blackheads and whiteheads, but it could also remove important oils from the skin, which can lead to irritation and dryness. So that's not going to help you with acne in the long run, and in fact it can make your skin worse if you don't moisturize afterwards. So we as board-certified dermatologists do not recommend pore strips. Instead, I would recommend either a clay mask, which is a much more gentle ingredient that pulls out excess oil and can help in terms of loosening your dead skin cells, or something over-the-counter chemical formulas that encourage skin cell turnover without stripping the skin. Some of the most popular chemicals used to treat acne are salicylic acid, which is beta-hydroxy acid, and glycolic